For my history final, I chose the topic healthcare reform. When people usually hear healthcare reform, they usually think of, like insurance, the insurance companies, the public, the people, healthcare, the system, Medicare, and so on. See, the thing about healthcare that people know by now is that it's not easy. It's not an easy thing to get or to come by. What I mean is, for example, in 2009, it was the year that healthcare had the most like cost. Like it was so it was the prices were rising so high. It was it was ridiculous how high it was getting. But when people begin to realize is that by law everyone should have and should be granted healthcare. The thing is that since it's so expensive, the people who are not trying to say poor, but aren't able to afford it, don't get healthcare, or they're not covered as much as people who can afford it. But here's the thing, people who can afford coverage and insurance don't really get the amount and enough coverage and insurance they're supposed to get. So at the end of the day, the people who can't and the people who can afford it don't really get the amount of healthcare they're supposed to, because healthcare should be available to all citizens who apply for it. See, people want to know when they sign up or are involved in a healthcare company or any program, they want to be informed and be well known that they're going to get covered in any situation. Their insurance, everything, they're going to pay the amount that they're supposed to and be on a good healthcare program. See, but that's not the case, because you would be surprised that everyone doesn't get covered. Also, those who get covered pay way more than they're supposed to, and that's just ridiculous. They are informed that their healthcare is good, that they have great quality, yet they're paying more than the regular payment is. And why is that? That's the thing that most people are trying to understand, because it's true. We don't understand why we have to pay more for our healthcare. It's just how it's developed, and that's not right, because in 2013 about 44 million Americans went on living their lives without having insurance, including those who have families who work hard and are trying so hard to maintain their life, and they still can't afford it because the cost of healthcare, Medicare, any health insurance become very expensive over the years. And now that is why people are trying to cut the cost of it. And that's where we get into understanding what our healthcare programs are telling us, the people, about what we need to do and stuff. And what I mean about that is that even though they can tell us a bunch of times that their programs work, we're going to be covered, and the insurance and everything is how it's supposed to be, it's not. And that's where Obamacare comes. When people talk about Obamacare, they talk about how Obamacare is a healthcare program which is affordable to anyone, basically. The Obamacare started on March 23rd, 2010. It's when President Obama signed the Affordable Care Act. It basically provides access to healthcare. It controls the cost and the rising of the prices for insurance or any healthcare program or anything that it is included or involved with Obamacare. And it also gives the people the choice to have an easier healthcare and to understand it more. And another thing that Obamacare offers is that it has private and public healthcare that includes insurance exchange and other reforms, which becomes helpful because it has new benefits and rights and protections to what people are looking for into a healthcare. So it's like, in a way, it's easier and more affordable for those. And they're also trying to to stop insurance companies that deny coverage, because if you might not know that some companies don't cover, or they deny coverage or health insurance to people who actually need them, or they even charge anyone more than what they should be paying. With all the opportunities that people are offered, I believe that Obamacare / Medicare is a good program for those who can't afford it, but don't have enough to afford it. Another thing, Obamacare also helps those that are in marketplaces that have small amount of employers and are granted covered by the health care by the government. And that also goes for the workers, even seniors. Now, when it comes to understanding more about, because you don't just want to walk into a new healthcare and not know what they're going to offer, because since you think you might get charged more like you used to. Obamacare is very different, as I said before, because it increased the cost of insurance for those who had to pay more, if I'm making myself clear, more about it. So here is where I talk about the arguments of both sides. So people who are against healthcare, Obamacare, or etc., think that the people who cannot afford the healthcare, can't afford the amount they're being asked to pay, should just not have healthcare, should just go to an emergency room and they'll be fine. But that's not true. Even if they go to an emergency room, they won't have the insurance or the healthcare to be covered. So that is just ridiculous, coming from those who think that the people, the poor people or the people who can't afford it, should just go to a clinic or anything and just they'll just give you help. But you don't understand that involves you having insurance. And people who agree with healthcare, they agree with most of the things I've said about how everyone deserves to have healthcare. It's a right, and also it's according to the law that everyone should have it. I think I said that already, but it's true. According to law, and it's a right. It's a human right for everyone to have health insurance or healthcare. And that is what people need to realize, that just because you can't afford it doesn't mean you don't deserve to get healthcare, or that you don't deserve to get help or anything to get you on track on getting your healthcare and your insurance and everything covered. And that's the end of my presentation. Thank you.